Good afternoon. Today what I'm going to show you in a very short video is how to use the straps for knee pain. Obviously you're going to use the straps in conjunction with other forms of therapy like spinal decompression, laser, infrared lights, physical manipulation, things like that. But today I'm just going to show you how to get started to use the conductive straps above and below the knee. So the first thing we're going to do is make sure that the patient is comfortable with perhaps a towel rolled here on top of a stool. Then we're going to go over here to a suitable sink. These are the actual straps, conductive on one side, not on the other. They're made so that the strap will connect whatever size you want. One size fits all. This is very specifically made to be conductive. It's made to be used with the electrolyte that you use in normally the buckets, the water bath. If you use any other electrolyte, you could burn the skin, change the alkalinity. This is designed, as with this, to be pH neutral. So you take this and you put a little bit of water, the electrolyte, on here until it's soaked. Now we're going to put this above and below the knee so that we focus the energy through the knee. That's one thing we're going to do. Second thing we're going to do is cause the calf muscles and the thigh muscles to contract and relax, which is going to stimulate the venous muscle pump to propel more blood back up towards the body. Then we're also going to stimulate the brain to release endorphins to cause the patient to relax. So we're going to focus the energy on the knee because that's where we want it. We're going to increase the local blood supply, and we're going to increase the release of endorphins for the patient. So we take this, we come over here, and we wrap this around the patient's upper part of the thigh. Bring the snap around here. Take the other one. Bring this about the patient's below the knee. You just get it snug. You don't want to cut off circulation. You should be able to put your finger in here. Then we're going to take the snaps, snap one on each. Doesn't matter which one goes where. Okay. Then we tell the patient that I'm going to turn this on and let you see that nothing's going to happen. I'm going to turn it off. You won't feel anything. After that, you're going to be the one who actually controls that. Is that okay with you?
Yes.
Okay. It's powered by a 9-volt battery. Perfectly safe, not a problem. Now when I turn it on, one of the reasons I'm going to turn it on first is to make sure that this is in the 7.83 setting. You won't use the EMS or the 10s. So I've determined that it's here, and I turned it on and off so the patient's comfortable that when she turns it on, nothing's going to happen. Okay, so if you would please, just turn it on and see that nothing happens. Good. Now I'd like you to continue to turn it on until you can just barely feel it. Once you get used to how it feels. It should feel like a little bitty thumping kind of feel.
Okay.
Okay, is that comfortable?
Yes.
Okay. I'd like you to continue to turn it up until we get some muscle contractions and get some actual vibrations here and here. There you go. Okay. If you come around here, you can see that the calf muscle is moving. It's causing the foot to move. So before, when we used the ReBuilder, only the calf muscle was jumping. This is designed in this position to cause a lot of muscle contraction. Now, if you look at her foot here, it's already beginning to pop out. And you see the veins are beginning to distend, and we'll see that more and more in a few minutes. So, that's all you have to do. At the end of the treatment session, you ask the patient to turn it down slowly to the off position, disconnect everything. In some cases, if you want, you can actually leave this on while you're performing other therapies.